Welcome to another edition of Tiny Talks with Our Heroes. Today we're with our school nurse, Melanie Penn. Melanie, thank you so much for your time.
Thank you.
So Melanie, can you tell us a little bit about your role at school?
So my role here at the school is to look after all the children's needs, the students, and even the staff actually. But I think I primarily focus with the boarding kids because of course they don't have their families or their typical doctors with them. So
when they feel sick they come and talk to you basically.
That's right. And so in the morning, the dorm parents check on all the children, get them going. But if someone's not feeling well, then I will be their first point of contact for that. And so they come and let me know if someone's not feeling well, and then the kids will come down and they will tell me what the issue is of the day, and then I do a full assessment with them.
How does the system in British Columbia work?
So in Canada, we have healthcare for all, and what that means is that we need to prioritize, so things that are deemed an emergency, people are seen immediately, and for things that potentially can wait a little bit longer, then it just works by looking at the symptoms and deciding who needs to be seen first. And so we're very lucky here that we have access to whatever we need. We have emergency services. We also have urgent care services for things that aren't quite an emergency but need to be seen, like an ear infection, for example. Someone who needs antibiotics quite quickly. They can be seen the same day. And then for other issues where a doctor really should have a good look and make a proper diagnosis, typically can take anywhere from a week to 2 weeks.
So there is a kind of a period to let the symptoms mature before they actually go to a doctor if it is necessary, right?
Right, and I'm a registered nurse, and so I can assess the children here to find out who really needs medical attention. And so if someone has cold symptoms or potentially a flu and can be managed here at the school, we will look after that here. If things progress and they need more medical attention, that can happen at any point in time.
Is self-medication common in Canada or not?
Well, it is to a degree. So self-medication for over-the-counter medications in Canada are typically pain management. And for like basic cold symptoms, but things like antibiotics is not something that we manage over the counter.
It's not something off the counter, so that's very important. Another question, Melanie, why is it important to report illnesses or chronic illnesses before they check into school?
If I can have the information ahead of time, then I know when they come to me what to look out for, because often kids won't come to you to say, I have this condition. They'll just say something hurts. And so knowing what their previous conditions are is hugely helpful in the health center. So if parents can fill out these admission forms with their health background, any medications that they take, potential specialists that they've seen, that definitely helps a lot. It helps the child.
And I always recommend parents whose students are undergoing a treatment to bring the medicine with them, and also the translation and reporting that ahead of time, and bringing the medicine for the whole period of their studies, and also the posology. And then the medicine will be kept here, right, at the nursing room?
Correct. And there are just some kids who are able to manage their own medications, and it's much easier for them, and so we can have that discussion when they come. And parents, if they feel they would like to speak to me, they can contact me directly when the child arrives prior to, or even any time during the year when something comes up. If you feel like you want to talk about a medical issue with your child, you can always contact me and we can just talk directly.
And another question that I usually have is about the dental treatment here. How does it work?
So dental care is not included in your overall health coverage, and so it is considered extra, with the exception of dental emergencies. And so that is something that's fully covered, and people with dental emergencies will be seen immediately. But people who have braces, for example, need any kind of orthodontic care, or they want to deal with cavities or any kind of cleaning, that's considered extra, and so the parents or the child can contact me and I can help arrange that with them.
Okay.